COVID is taking lives, young or old. My name is Sarah Eberly. I've worked at St. Luke's for 6 years in the ICU. I'm a registered nurse there. Back in the spring, we were, it was bad. We opened up our ICU, COVID ICU up on the 5th floor. Those 8 beds up there, we had backup plans for, if that filled up. We were seeing what was going on the East Coast in other countries, expecting it to get that bad, and luckily for us back then it never did. That peak never came that I think we were all expecting. In the summer, things got a little bit better, a little maybe back to normal if you could say, and then this fall again, we just got hit hard with finally what we were all expecting to happen. We've healthy people, healthy young 30s, 40s are getting intubated and on the vent for weeks at a time, maybe ending up with trachs. You never know either who's gonna do better and who's gonna do worse. It's like a flip of a coin. It's that moment right before you intubate someone where you ask them if they wanna call their loved ones and talk to them. And that's hard. I've made too many of those phone calls to family. But it's something that needs to be done. It's something we try to do for them and their family. It can happen to anyone, and you don't know if you're gonna be that person that's gonna come to the ICU and be put on the ventilator. You just don't know, and that's why people need to be safe. We just all have to pull together just a little bit longer, just a little bit longer. The vaccine is here. I think after this, I think there'll probably be quite a few nurses maybe burnt out and want to leave bedside nursing, but I also think a lot will stay. I can't leave bedside. I'm an ICU nurse through and through. It'll be one of those things where we talk about to our kids and our grandkids, and yeah, I worked through that, and what was it like, and oh, we did this and we had to do that, and people aren't going to believe it. People are going to think, wow, that's crazy. I can't believe that ever happened. And it's like, well, I lived it. I lived through it. I think people should know that if you don't have to come see us in our great team, that's not necessarily a bad thing. When patients leave the ICU, my thing is I usually say, I hope to not see you again, in the best possible way, because no one wants to come see me in the ICU.